Yeah, good evening, everybody. How are you doing? Welcome to another session of Ask the Doctors. My name is Dr. Frederick Unubohai, and I always tell you good life in a sense. You know how we dey do am, Abi? Very good. Um, I know the day alone. I did day with my co-host, Dr. Israel, and Dr. Israel will join us very, very soon. Today's program na question and answer session. So if you dey watch this video, the time na 8 p.m. already. Today na 2nd of April. Happy New Month. And we go just do this live stream for 1 hour. We go take your questions. Any question wey you get for us, we go drop the question for here. We go try take am. This program na every Sunday, 8 p.m. with African time. We dey come here and we dey respond to your questions. Sometimes we dey even do some little teachings. But today, na question and answer we wan do. Hmm? Mhm. I dey charge my device wey dey give me network. Very good. So I can see say we get some people already in the house. Good evening. How are you? Who dey here? Yeah, Kata, how are you? Catalina, Musu Kamara, I see you. Maxwell, how far? Yes. I dey fine. Musu Kamara. Who else dey here? Jessica Ediri. Jessica, how are you? You don't tell. How you did? Tina, thank God. Tina, how are you? Happy New Month, everybody. Welcome. Okay. Yeah, good evening, Ma. Lucy, how are you? Good evening. How you day? Hope it is. Happy New Month. Happy Palm Sunday. Yes. Welcome, everybody. I see you now. Oh, yeah, share the live stream. Ladies and gentlemen, share. Maybe get some people, maybe they can join us tonight. Hmm? Then if you get questions, ask us, I beg. If you get questions, ask us your questions, drop your questions. Feel free to ask. May we gist this night. Then, yes, very important. I will do giveaway for one person. I'm going to do giveaway for just one person. I'll give the person 500 naira airtime. I will give the person 500 naira airtime. I don't get money. Oh. I wish say people feel they sponsor this program, make they get back, but no back. Hmm? Yeah. Yep. So at the end of this program, or towards the end of the program, towards the end of the program, I will do giveaway for just one person here on the live program. Here, we will pick that person 500 naira airtime. But if you want sponsor, you can feel free to do so. We are share the live stream, guys. Good evening, Ghost will have fun now. Ghost will say I'm a top fan. Ghost will I see you. Joy Chukudi, how you there? I see you. So tonight we go do giveaway later, very soon before we end the program. We will do a giveaway and now for just one person. If you did hear me, tell me your questions. Catherine Israel, Katrina Israel, I see you. How far? Oh yeah, ask me now. You don't get question to ask me today. Hey, glory. These people don't want to ask us. Okay. Juwaria Iye. Good evening. Who dey YouTube? Who dey YouTube? Who dey YouTube? Nobody dey YouTube. Who dey YouTube? Hey, Generic Comrade, how far now? This your name, eh? Very unique name. I'm gonna do giveaway today. You will not qualify for that giveaway. Oh. The 500 naira. I want to give somebody airtime. Hmm? But you will not qualify for the giveaway. You know now. I will make I let you qualify again. Good evening. Okay, who dey YouTube? Yeah, somebody's on YouTube here. Good luck blessing is on YouTube. Good luck, how you day? Good evening. Happy Sunday, Jennifer Bridget. How are you? Oh yeah, now make una send me stars. Oh yeah, people will watch me for Facebook and even YouTube. Send stars now. Hmm? Send star come. Send star my way. Send the star come. Please, can high prolactin make somebody lose weight? Are you losing weight? Yes or no? Do you have hyperlactin? If you have hyperlactin, hyperlactin is not a common cause of weight loss. Hmm? Lucy, hyperlactin is not a common cause of weight loss. So if you are losing weight, huh, you have hyperlactin, you should speak with your doctor. Do you understand? Yeah. Good day, yeah. Esosa, how are you? Esosa na guy, yo. I greet you. What vitamin tablets do I need to drink? I'm 2 months pregnant. Okay, congratulations, Charity. Mm, you're supposed to register for antenatal. Sure you know. Sure you know, right? And you're supposed to register for antenatal. And this one also, you need to take things like folic acid, ferrous, B complex, vitamin C, and the rest. You understand? Yeah. So if you're pregnant, I beg, go hospital. Hmm? Very, very important. Yeah, I see you. Yes, yes, I see you. I see you. Welcome. Alpha. Good evening, Doc. Happy Palm Sunday. Yes, so Amina Alpha. Oh, yeah. Oh, drop your questions, please. Feel free to drop your questions. Good evening. No, no, it doesn't look me. Okay, no problem. No problem. No problemo. Favor, not this kind of stuff, my dear. Favor, Chigai, how are you? Charity. Okay, good, good, good. Congrats. You're welcome. Favor Alpha, not this type of star though. The star you buy, you click on the star. See this star down, this star here. This star, that is the star I'm talking about. Eh? This one. Very good. Okay. Ask your questions, ladies and gentlemen. Okay. The funny thing is say, now where I dey online, may we take questions. Lucy, how are you? May we take questions. No, no, no. Okay, Jennifer Bridget says, I'm always feeling burning sensation around my waist and back. Don't know what to do. Burning sensation around the waist and back. The first thing is that what do I even tell you right now? 'Cause when you say you don't know what to do, I hope you know that we can't prescribe, but burning sensation in your waist and back, if you don't take time. So this is my advice to you. If this burning sensation, it don't dey do you for a long time, and then try, try speak with your doctor, see your doctor privately. But if this burning sensation just starts a few days ago, I don't know your age, I don't know anything about you, so it's quite difficult really to tell you. But burning sensation, check your blood pressure, check your blood sugar, ensure you are not stressed. Take multivitamins and see how far. If it improves, fine. If it doesn't, please speak with your doctor. Okay. Esosa say the star not the show for my Facebook. Yes, you are on my Facebook page that can't send star. Esosa. Hmm? You are on a Facebook page that can send star. For those who they watch this video, you want to send star, go to this page. Go to this page. Um, Dr. Ejolafa,
Fine, fine.
good evening,
That stuff
welcome.
we'll do it later. I could not get it.
Okay, no problem, no problem. Okay, so for those that want to send star,
How is
go to
this
this.
person bearing my name?
Okay, Dr. Israel, welcome. Good evening. So somebody says, see question, Dr. Israel, why did you put off your why did you put off your hair? Okay, okay, no, it's not you. No problem. It's here. I can see it. Okay, so we have a question. What causes panic attack? I need to know. Dr. Israel, please respond.
Okay. Panic attack can be caused by many and different things. Fit cause am. As the name apply, panic. Anything that can cause you to panic, it will lead to that. It leads to a panic attack. So anxiety can cause it. Post-traumatic issues can also cause it. When something have happened before and you notice that it's about to happen again, somebody can have that. When the person can become the panic or about the thing, so it can actually lead to it. So post-traumatic event, people when they experience robbery, when they see anything that look like it, even though not be robbery, anything that look like it or something like that touch them, they can actually have that kind of the attack. People that have anxiety issue, any small thing, their mind don't fly. Any small thing, their mind don't fly. In fact, that their mind don't fly. Now they call the panic attack. I have one friend when we say they rob one time for our school gate. Then when we were still in school, they put something cold for close to a waist. After that time, anytime we put even our hand when we go close to a waist, the guy will jump up like say they want robber or something like that won't happen again. And later he told us, I beg, Mona not do that thing again. So those are things that can actually cause panic attack. So it is left for you to reshape your mindset and know yourself that okay, these things will not occur because they happened before. Don't mean say they go happen again.
Yep, thank you. And if I may add to that, if your panic attack they affect you, like they affect your normal daily activities, you know, if you work when it comes, it will make you day weak, go to shake. Hmm? Speak with your doctor, see them. Maybe they go prescribe something to help you too. Again, make I talk. I go do giveaway at the end of this program. Just one person giveaway 500 naira airtime for just one person. And the reason I'm doing it is just to just say and just encourage you, understand. Not to say we get money to share, no. But at the end of the program, just give one person 500. We do giveaway. And we have a question here. Please, what is the cause of severe headache? Dr. Israel.
I think we get one presentation on headache. So there are different things that can cause headache. When the headache don't dey severe, abeg, we go advise say go see your doctor. Go see your doctor when the headache don't dey severe. So one thing fit be space occupying lesion. When something dey occupy the space when your brain suppose cover, it can cause severe headache. Stress can cause headache. Even other sickness, people wey get malaria, all those, they can have headache. What they call migraine. And that one can also cause severe headache. Now there are some drug. Dr. Fred, you dey hear me?
Continue, I dey hear you. Continue.
Okay. There are some drug when go fit cause headache. One of the drug when we say their side effect na headache. One of the drug na gentamicin. If you give some person gentamicin, the kind of headache when they will get for some seconds to minutes is severe enough to cause anything to that person. So when you have even trauma to the head, can also give you severe headache. When person fall, hit the head for ground, e not tear, but e just hit the head for ground, the head all shake one kind. So e go still fit give person severe headache. But the thing is that anytime you get headache when you don dey when you try sleep, e no comot, you take analgesic, some medicine when they say e suppose work for headache, e no work, abeg go see your doctor. Because if fit just be say something when we dey call space occupying lesion, something fit just dey grow for the head wey no suppose dey there, and that one go dey make the brain dey tight, dey make the place feel like say e wan expand, whereas e no fit expand. So that one fit lead to headache, and even rupture to some of the arteries for the brain fit still cause headache, those severe headache wey you dey talk.
Yeah, thank you very much. Finally, again, I beg, do not joke with headache. If you dey get severe headaches, our advice every time at the end of any tool we advise you to say, speak with your doctor. So we get another question here. Please, I want to know the fertile window of one whose cycle is 26 days. Dr. Israel, okay.
Okay. Again, there are ways we used to calculate this fertile issue. But let me just use this layman way. I don't want to go details. There are some. If I want to go details, there are some things I go need to say. Then, but let's just leave that because that will take a lot of time to explain. But um, for when they talk about a fertile window, some persons most of the time are actually asking their peak period, that is their ovulation day. So which is like we will normally say the middle of your cycle. So if you get 26 days cycle, just divide them by 2. The middle of it is most likely going to be your ovulation day. Sometimes it not fit be that day. Sometimes it can happen 2 days before. It can happen 2 days after. So, but we believe say that period, like up to like 5-6 days now, if I may say, are mainly your fertile period. It means say that period, anything when happen, person fit get belle. Now, another way when you fit know say na your fertile period, now you dey so, na your fertile window. Now, for every woman, every woman gets the own mucus discharge from the vagina when they see normally, and not be saying a bad one be that one. Normal mucus discharge. So when they come find out, say the discharge when they come out, if they try touch am, it dey slippery, it dey slippery, it dey draw, and if you look at it, be like when you break egg, the white raw egg or the white part of the raw egg wey dey what wey not get color, and e be like that, then you know say you don enter that fertile period of your. Fred, did you still hear me?
Yes, yes, yes.
Okay, you know say you don enter that fertile period of your ovulation, and as at that time, if you meet your husband, there's every tendency say you go get the person can become pregnant during that period. So first thing first, you should first of all know that it is, as I said, at the middle, which is if you divide 26 by 2, you get something like 13. So that 13th day doesn't mean that it must be that 13th day. You need to count 2 days before the 13th day or 2 days after the 13th day. So that period, so we simply mean 11, 12, 13, 14, 15, 16. Those periods are most likely your fertile window period. And that period, you first if you get as the case may be.
Okay. Make I also add something to this. I guess this person just they stumble on this page online. So I would advise you go to YouTube, my YouTube page, or even this Facebook. You get one video where I make on how to calculate your ovulation. So your fertile window now few days before your ovulation, and maybe you go take one day after. You understand? 2-3 days even before your ovulation. So this thing wey doctor usually talk does not apply to everybody, because some people fit get their cycle of 30 days, some fit get 35, and if you divide am by 2, you know wetin that one mean. So e get how you go need to fit calculate your ovulation. Then you go also download, e get one app wey ladies dey use. The app, they get different types. One na Flow app. You can download the Flow app too. It go help you so that it go guide you. But the other thing again, where Dr. Israel talk now, the signs of ovulation. So ovulation get many many signs, especially when you know they near your ovulation. So it go good make you also know the signs of ovulation where you get, so that make you no be like say you know see that mucus discharge, you can't dey cry say I no see the mucus, problem don dey for my life. You understand? We get another question here. This one says, if doctor say person kidney they get bad, wetin person fit do to wake the kidney back? I beg, before you go answer, Dr. Israel, I want this person. Now, doctor tell you say kidney they go bad. I mean, now you they talk say kidney they go bad, because no doctor go tell you say kidney they go bad. We can't leave you. So tell us the real reason why you dey ask. Now you go lab by yourself, go do test, or now somebody for roadside tell you say kidney go bad. Because if now medical doctor tell you say kidney they go bad, they will give you medical advice. So no just come tell us say kidney they go bad, we can't continue. I beg, tell us who told you say kidney they go bad, because the doctor will talk so everybody for outside a medical doctor. Dr. Israel, I don't know if you have anything to say with regards to this.
Yeah, I think that's the truth. No doctor will tell you say your kidney they go bad and will not tell you what you should do. They will always tell you what to do to prevent the kidney from getting bad. Eh? And they will even want to place you on some drugs safe if actually your kidney they go bad. And so as Dr. Fred said, if not doctor, let us know. And
He say
okay,
yes. Now
he said
doctor,
yes,
I show him
and
the
issue
result.
the result. So I don't know the result, the test you did. Most of the time, yes, I don't know the test you did. Most of the time, a specific one test you do, not go your face say your kidney they go bad. However, if you think say your kidney they go bad, the first thing when you go do, because there are so many things where if you cause your kidney to go bad. If you they drink, you need to stop. If you they
See
smoke, you
the
need to stop. You need to they
see
drink
the
a lot of
comments.
water. So if
See
you
the
they drink a
comments.
lot of water, you go the urine. Dr. Fred, did they hear me?
I they see you. See the comments. See the comments. See the comments. Number one. Just wait. Did you hear me? See the comments. Wait. Huh?
He said, man, I
I
take
asked.
paracetamol.
Wait now. Just wait. Wait. I beg. Wait. He says. I asked. He tell me. I asked doctor. He tell me check the results. Say make I take paracetamol. Then guess what? He says full blood counts 9. I do. Now full blood counts 9. You do.
I better not be kidney that. I better not be kidney that tell you I beg, I beg. In fact, I don't know who you meet. In fact, not be doctor you meet. If not kidney, the person tell you not be doctor you meet. I beg, I beg.
Yeah.
Not be doctor you meet. Now make I know. That's why I said, what kind of test did you do? I don't know the kind of test you did. If not full blood count, voila, full blood count will not tell you about it will not tell you anything serious about the kidney, seriously. And you know, if you can't tell you say me they paracetamol. I still they try to understand what the paracetamol get to do with kidney. The organ where would they fear when it comes to paracetamol na the liver, not be kidney at all, na the liver, because that is the organ when paracetamol they damage. So I don't know who you see, and I think that was the wrong explanation to you, or whatever he gave to you. I think that was the wrong stuff. Or maybe the person see the training, or maybe he just they pull your legs.
Okay, thank you. Let's go to the next question here. The next one's before we continue again, I beg, make una share this live stream, ladies and gentlemen. The least you can do is to support us. How? Share the live stream. Then, if you want to go further, you can send stars, digital stars, not the comment star winner they put for here. That's how you support. I beg. So share the live stream, invite your friends, ask your questions. If you want to send star, you can send on Facebook or you can send on YouTube. That is how you support us. God bless you. The have a comment here says, "Is fat good for the body?"
Okay, is fat good for the body? Yes, fat is good for the body. And fat is good for the body. The only problem we get now, make the fat not too much. Because even sometimes the body depend on fat during hungry period. Now fat, some fat wey dey the body, na the body till they survive. Now those fat, the body will come go dey build until they form glucose, wey go dey keep us going. So fat is actually good for the body. However, there are different type of fats, and there are different type of fat. We have the cholesterol, and that cholesterol now they always say it's not too good for the body. It doesn't mean that it's not good. It doesn't mean that it's not good. We only say it's not too good for the body, because it gets in your own number, your percentage when it's supposed to for the body. So if you don't pass that percentage for the body, then that's when problem comes. In fact, every chemical or every hormones when they human being body get in your specific number, amount when it's supposed to. So if that amount don't they pass as it's supposed to, that is when it becomes a problem, even with fat. If the fat, even glucose, now they call diabetes. So fat as well, if you don't pass the amount when supposed to be for body, it gives us then and then it's not good. But normally fat is good for the body.
Yep, thank you very much, Dr. Israel. To know more again about the fat cholesterol, you can check my YouTube. I made a video on that. We have a question. Good evening, doctor. Please, what causes mouth sore and how can it be prevented?
Okay, and many things can cause mouth sore. Even some sickness when person is sick, they give you. Dr. Fred, I wish together.
Yes, we are together.
Hello, Dr. Fred.
But they hear you. Go ahead. Go ahead.
Okay, I should go on now.
Yes.
As I said, even some sickness when person is sick, even give person mouth sore. Sometimes even when you when you by yourself fight your tongue, you can get mouth sore. So there are some bacteria, some viruses that can actually, and some fungi that can actually cause mouth sore. So the good way to take care of your mouth is to prevent those things is to eat your balanced diet. So when you not eat good food, you can also have mouth sore. So eat your balanced diet that contain all the vitamins that you are supposed to have. So when you get all the vitamins, some of those mouth sores that can be caused due to lack of vitamins not good day there. So also check yourself regularly to make sure so you not get some sickness for body. And so because I said some sickness will cause mouth sore, will give you mouth sore. And every time try to see your dentist. When they check your mouth, they will find out if there's anything that you need to prevent. So brushing your teeth morning and evening is also a very good way to prevent yourself from having any kind of sore in the mouth, and that bacteria or all that can actually cause. Yeah, I think that's what I would say about mouth sore.
And that's in the game because mouth sore. Now, when your immune system, when you get immunosuppression, many things can cause immunosuppression, some infections. So, like Dr. Israel said, I beg, speak with your doctor. Very important. And then I want to come again. We'll do giveaway for one person towards the end of this program. Giveaway for just one person. Airtime, 500 naira airtime to just one person. We have a comment here. Doctor, good evening. I did implants since 2020, so I removed it since last year, April. And since then, I haven't seen my period, but I have not been seeing my ovulation. Is that what you're saying? What can I do? You haven't seen your period, but you've not been seeing your ovulation. Okay, Dr. Israel.
Sorry, I not get your question. Your voice was breaking.
Okay, see the screen. I did implants since 2020, so I removed it since last year, April. That's about 2 years. And since then, I haven't seen my period, but I have not, I believe it's not been seeing my ovulation. What can I do?
Okay, now two things they happen. Why if be say you not even remember, you never know that you they see your ovulation. Because ovulation most of the time occur before menses. Ovulation occur before menses. So you will not feel the same menses if you know they see your ovulation. That's one. Two, if it be say the hormone never well regulated in your body. And so if the hormone never see your body hormone never well regulated, you can actually be seeing your menses, and sometimes you will not ovulation will not be there. So that bleeding you are seeing is still like the family planning that you did bleeding that you are still seeing sometimes. But these are the two things that can occur. And also you need to actually try and track yourself, try and track it to see if yes, your eggs are being produced and if ovulation is actually taking place, which you are not aware of. Now, for some time when I don't know when during the period you do the family planning, if you were seeing your menses, you know, some persons after some time they feel not even remember how their body system did. And so you need to still relearn your body system. You really need to relearn your body system. So when you relearn it, you will actually know if you are actually ovulating or not. As I earlier said, menses does not come without ovulation. Ovulation takes place before menses. That's one thing you should know. Then if you think, say, yes, you actually know they see your ovulation, another thing Phoebe say, now because of the family planning you do, which never fully wear out from your body, now they cause that. Then the third thing I would advise is that see your gynecologist, see the gynecologist, so that they can do some tracking for you to find out if you actually stay ovulate or not.
Thank you, Dr. Israel. Okay, ladies and gentlemen, if you just come, welcome. We take questions tonight. Drop your questions. No forget to share. I beg, share. That is how you support us. Share, not just day like that. So share and then send stars. Okay, we have a comment here. It says, but doctor, some women normally don't see the mucus discharge. If you watch my video on ovulation signs, you will understand. Yes. So please watch the video. For ladies, whenever watch the video on the signs of ovulation, watch it. We broke some things down. Okay, we have a comment here. My question is, if I want to start seeing my menstruation, before it starts, I'll start feeling itching. Before the menstruation will start coming out. Okay, let me quickly. I don't know if you are still here watching us. Has this been happening to you since you started seeing your period, or it just started? If this has been happening to you, it just started to happen to you. Maybe not a problem. But if you don't do you since when you started to see your period, if you be safe, maybe now show your own day. So, is there any comment to add to this? So it's ready, hear me?
Yeah, you say waiting. Okay. Dr. Fred, you hear me?
God, your network.
Can you hear me?
Yes.
Okay.
I hear you.
For this person, yeah, and the question is actually a question the person need to answer. We need to know if this inching started recently or not. If the inching started recently, you need to do some other investigation to find out if there's an infection or not. But if the inching has been there right from time, even though not be from the beginning of his menses, but he has been there for a very long time, I know that now only when he wants to see menses, now the thing they happen. Once the menses finish, he stop. The inches stop. No problem again. I want to say there's nothing you can do about that. It's just part of you. There are some people when they say it's just a sign. It's just one of those body sign you normally see to know that your menses is coming. Some people they will be saying I'm discharged, or you're noticing that they don't discharge, but the discharge is not smelling, and it's not really disturbing them. Before they know, menses start. After menses discharge stop, no other thing again. They don't see any other thing again. So for those kind of persons, even though you give them drug for nothing next year, in fact that thing will still continue to happen. So it's just part of them. So for you, if it has been there for a very long time, I don't think it's what you should do to disturb yourself about. It's just part of you. And mostly if you know, say after the menses, the injury they stop. It's not like after the menses, you now need to take drugs before the injury goes stop. Also, you should know that hygiene is a key factor when you are seeing your menses. Hygiene is a key factor. How did you keep yourself clean? How often do you change your pad and all that? Still need to play a key role to this as well. And some people they react to pad when they use. So when some females see any injury at the beginning, but when they start seeing the menses and start using the pad, they start having those kind of inching and all that. So you still need to know that if that's how it happens, so you know if it's to change your pad or not. Okay, I think that's all I want to say.
Okay. The next question we have here, let's see, we have another one. You see this comment, Dr. Fred, what about taking cholesterol drug for since 2018 to 2023 now? I did take this drug. My guy, I want to ask you one question. Who placed you on this medication? It's not enough to come online and start telling us, say, I did take this medication. Who give you? Who prescribe them for you? Why did they take them? If you have a medical doctor that prescribe your medication for you, continue as advised by your doctor. But if you don't get any medical doctor will prescribe this medicine for you, you just wake up, you go carry medicine to drink. My advice to you on this program, say quick, carry yourself, go find doctor, make them check you. I know we don't go come online here, continue to take this medicine when we don't know anything about you, and we don't even prescribe medicine online. So I beg, who give you medicine? What was the reason? Your doctor say me you take them. If now your doctor say me you take them, sorry guys. Now my doctor say make I take them. Very good. Please continue. We no go tell you make you stop. You understand? I beg. Go ahead. Is that okay? Dr. Israel, do you have anything to add to this?
Anything concerning what this person said, I don't want to say anything about it. I don't know what he's trying to do. However, if you have anything to ask or anything to say concerning this, even this result you are putting everything, please. I'm not saying you to test, so I am not really here to interpret anybody's result. I think you have a doctor that did that, so let your doctor interpret your result. Let your doctor do the prescription, and whatever your doctor prescribed for you, please be faithful to it, and try and visit your doctor regularly. That's just it. I saw one patient recently. The doctor placed her on a particular drug. They are treating the person for BPH, that's benign prostatic hyperplasia. So they treat the patient for that, and for a very long time, this person not go see the doctor again. After the doctor don't place him for drug, I think for almost a year, the person have not gone back to the hospital for follow up. So he came to meet me in an outreach. He came to meet me, and I told the person that I not give the person one thing. I tell him, say make he go back, go meet the doctor. That's not how to do treatment. You are supposed to do follow up. I don't know whether your doctor tell him may come for follow up, but the person goes to go for follow up because he was having some other kind of complaint, and which I think is also related to what he had. So I just advise go and see your doctor because he knows why he gave you those drugs, and if the dose is no longer very effective, he also know what to do for you. So the same thing we they tell you, Abdul Malik, please go and see your doctor. He has the final say to this. Thank you.
Thank you very much. Okay, soon we will do our giveaway. We have the question here. I beg, doc, what's in the cost teeth or tooth decay?
Dr. Frey, answer that one.
Okay, many things they cause teeth decay. Most times people they get tooth problem or they happen with children because of the sugar where they chop, sugar they react with that teeth. Another thing we say, people if you get problem with infections, you go chop some teeth, you go inside your teeth, bacteria for your teeth, because they react, because cause problem. So many things they really cause them. Maybe give you infections and the rest. So if they get tooth problem or teeth problem, the best advice is say they will need to examine that teeth, check them. If not something where they feel, where they give you medication, they will tell you. If not something where need that tooth, may they extract them, and may they come out them, they will tell you. So you need to ask yourself, this tooth or this teeth they pay me, it decay, I mean no decay. If they tell you say it decay and they need to extract them, you will need to follow your dentist advice. You understand? That is basically the stuff for tooth, because most people tell you say I don't want them come out, I don't want them come out, but really most times now the only solution be that, because teeth problem will disturb you for the rest of your life. So find out, speak with your dentist, and then check them again, what they cause this problem, and something they feel correct, or you need to come out the teeth. We have a question here. Good evening. How I will take reduce menstrual pains? Okay,
Okay, how you
Israel.
want to reduce menstrual pain? There are different things somebody can do to reduce menstrual pain. First of all, we want to know, is this menstrual pain a normal menstrual pain? You know that some pains, some menstrual pains that are not really normal, they are due to some problems. So you need to first of all clear that out, that, oh, I'm not having endometriosis, I'm not having infection, I'm not having any other complications that can cause pain during menstruation. I'm not ever having fibroid, all those things. Because if those ones are there, they will cause you pain. It's for you to first of remove those things. And once you remove those things, the pain will stop. That's one way. Now, but if it's a normal pain, there are some exercises you can do, some waist training that you can do. And those waist training can also help you to reduce menstrual pain. And also you can take some analgesics few days before your menses, or some persons even they take on that same period. The only problem with the drugs you take is that they can alter, some of them can alter your menstrual flow. Some of them can alter your menstrual flow. However, they can also help you to reduce the pain. Note, they're not going to stop the pain. No, that one. They're not going to just stop the pain. Pata, pata. They, as you earlier said, reduce. They go reduce the pain. And so some exercise, waist training exercise can help you reduce the pain. Some medications can also help you reduce the pain. Also find out if you have other comorbidity like fibroid, endometriosis, infections, which can actually cause pain during menstruation. So if those are there, treat them. Treat them. When they are properly treated, you not go get pain again. So that's how I want to answer that question.
Okay, thank you very much. This question I just quickly talk about. And good evening, sir. What is causing low blood pressure and what is the remedy? So for low blood pressure, again, I think I made a video about low blood pressure. There is something where I don't see. People they talk so they get low blood pressure, whereas their blood pressure they normal. Because I go see people go check their BP, they'll just say they low. Whereas you know see doctor, you get people who say their BP go day down. We go look them, they no get any symptom, then they physiologically fine, maybe because of their body size and the rest. We don't go think say they get problem. But if we check, say your BP low, the doctor look you, be like say you get some other symptoms, which together move with your BP. They'll say, oh, really, you get low blood pressure. So my first thing to say, you don't confirm from your doctor if you get low blood pressure. Number one, the remedy to manage low blood pressure, it they tied to the thing where they cause low blood pressure. Example, somebody with they vomit and with they purge, we get diarrhea. If the person they purge, vomit, the BP go down. What you go do? You go give them fluid, IV fluid, to help them bring back the BP. And that thing again, they say, if person heart they fail, the BP if it go down. Now the management now to help the heart, make the heart no fail. Another thing again, if you make the BP go down in pregnancy, some women BP if it go down in pregnancy. So the doctor will look the woman, go manager, oh madam, we know say this thing they okay with you, no worry, we'll keep close eye on you. So there are so many causes of low blood pressure, and the way you go correct them now when you know waiting they really cause this person home. So we get many causes of low blood pressure. Finally, for my own part, now say ensure say na medical doctor nine confirm say you get low blood pressure, and if indeed na medical doctor confirm am, e go tell you waiting and waiting. No doctor, I repeat, no medical doctor wey dey trained go see say you get problem, e go just fold hand leave you. If you no get the answer, e go refer you to somebody wey get the answer for you. Do you understand? So Israel, do you have anything to add, please?
Yeah, I think you've actually answered it, because one thing we need to know is that low pressure kill faster than high blood pressure. That's the thing. Low blood pressure kill faster than high blood pressure. So nobody could see low blood pressure and let the person be. Once your once your pressure, the blood pressure is becoming low, it means that the person they die they go. So once you are very fine, you are okay, and we check your blood pressure is somehow low. Sometimes I know they tell you say you get low blood pressure. Why? Because some people, as Dr. Fred said, that's their normal blood pressure. Like me, when they talk to you, so before my blood pressure is 90/60. Doesn't mean I have low blood pressure. No. Now it's 100/70. 100 over, sometimes 100 over 65. To me, it's normal. And to me, it's normal. So for a person like me, if I can't go blood pressure of 130 over 90, I got to look and say I don't get hypertensive. I'm now hypertensive, even though it's still within normal. So if your blood pressure is low and you are still living fine, no problem, you are not getting any issues, and you are not having any chronic issue as well, I don't think you should be worried. You should just let it be. So because your blood pressure is always tied to something. So whatever you need to do is to treat whatever is tied to. That's what will help you.
Okay. Doctor, I have treated infection last month, but changed this month. I'm still having discharge and oh my God. You understand this question?
Say you have treated infection last month, but I don't know why you put change. But change what? This month I'm still having discharge and reaching, I don't know. I think the person needs to send the question again because we cannot understand what you are saying. And
Yeah.
also remember, say this month just start yesterday. So this month just start yesterday. Yesterday was first, today is second. So please try and tell us what you are trying to say. We don't really get your question.
Yep, we don't really get it. Let's see. Okay, let's take one more. Which one question again? Oh God, see questions here. So many questions though. Okay. Too much weight. Does it affect someone's period? Dr. Israel, respond now.
Straight answer, yes. If you have too much weight, it can affect your period. If you have low weight, it can also affect your period. So let's just give you a straight answer. Someone that is obese, they can have problem with their hormones, and that will affect their period. And someone who is still underweight, those kind of person feel never see their period, because the body go look and say this person not go fit handle the process of seeing period. So yes, it can actually affect your period.
Okay. Okay, so maybe do giveaway. More we do giveaway sharp. Quickly, just one giveaway. So this is what you need to do to qualify for the giveaway. Ladies and gentlemen, you click. So to qualify, you put this hashtag good life nonsense. Oh yeah, let's go. Put in the hashtag good life nonsense and then put you qualify, then we do the draw quickly. At the wait. Let's go. That is how we're going to do it quickly. Dr. Israel, no vex, we'll just do this one. Yeah. And wait for a comment. So you put in this is how to qualify. Yeah, let's do just one giveaway. We send to one person. The rest people just there the Lucas. Oh yeah, I'm waiting on hashtag. See waiting screen. See waiting there your screen. Put on the way there your screen. If you know put on well, you know go qualify. I'm serious. We have just 2 minutes. Spell them well. Spell them well. Oh yeah, let's go quickly. I'm waiting. Oh. I'm waiting. Spell them well. You're not spelling it well. You're not spelling it well. See hashtag. Put this thing where they screen. Like these people never understand. They don't want to give away. Let's continue. Let's continue. Nobody is dropping comments. Thank you for keeping back our. Okay, somebody is dropping comment. Okay, I see. Okay. Okay, I see. Okay, we have Lucy. You are not putting it, so you've not entered at all. See waiting date the screen to qualify. You put this hashtag.
For then Joy.
Let's see how many people don't enter. Let's see. It will show only 4. Okay, let's do the draw then. I think I just be 4 people. The rest no puts. No puts the stuff. So let's do this. Let's pick, right? Let's pick the person. No, only 4 people out of how many people they watch us here? Over Over
Some
25.
25.
Only 25, but only 4 people. So let's just do this and pick one person out of the 4 people. Okay, let's go. Let's pick one person, one person, one person. Who? Okay, yeah. Our
Joy.
winner is Joy Chuku. So Joy Chukwudi,
Chukudi.
you you drop your number in the comment section, and then we'll send a transfer of 500 naira airtime to you quickly. So let's go back. Let's go back to what we were doing. Dr. Israel, let's take questions again, and then we are done. I beg you, I not see anybody. Oh, please, 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 please. I gave instructions. You don't they listen. Okay, Dr. Israel, see questions here. Let's just take this and then we'll be done for today. See questions. Okay. Doctor, what are the causes of insomnia and the ways to overcome it?
Now, what is insomnia? Insomnia, it means say person not they sleep for night, or person not they get sleep. So many things will cause insomnia. Let's go from simple one. People when they like to watch film throughout the night, now stay insomnia. So that one cause. So what to do to prevent that? Off your television, off your light, go and sleep. You don't prevent that. So 2, some drugs can cause insomnia. So for that kind of person, we'll tell them, say, not take that drug in the night, take it in the morning, so that before the drug work finish, that particular side effect if you don't come out, then you will feel sleep in the night. Yeah. Some people, anxiety can cause insomnia. Psychological issues, depressions can also, and so the person not go feel sleep. So for all those kind of case, you need to see your psychologist or a psychiatric doctor. They'll get some medications when they'll give you, when go help you out. And some people pain and some kind of sickness and pain and all that can also cause insomnia when they feel pain in the night, coughing and all that like when you not feel sleep. But you should know that insomnia is not like what happen for one day. It's something will happen continuously. So you not sleep one night does not mean that you have insomnia. So, but if you don't be continuous something, don't they pass 2 days, 3 days, 4 days, then that's when you can call it insomnia. And that's when you can start thinking of things to do. So some drugs can cause it, psychological issues, anxiety, depression, post-traumatic issues, all these things can actually cause insomnia. Some other chronic illness can actually still cause insomnia. So what you do is to treat the underlying cause. When you treat the underlying cause, the insomnia itself can go. Insomnia itself can go. Why some people have some sleep disorder. Sleep disorder can cause insomnia also. And it's also a psychological issue.
Thank you, Dr. Israel. So Joy Chukwudi, sent the airtime to you. I've seen your number. I've sent it to you. Thank you very much. Okay, Dr. Israel, let's take one more question today, and then we should be done. One more. Good. Okay, this one says, please, sir, I dey get recurring pain and discharge. I don't go hospital tire yet. No improvement. What could be the cause?
Well, I don't know how many hospitals you don't go when you tire. However, it's not by going to hospital, it's by meeting the right person in the hospital. That's the most important thing. So when you go to hospital and you are not meeting the right person, you just be doing your own, you are just going to the hospital for no reason. So you need to see the doctor when they take care of ear. They call them ear, nose, ENT, yes, ear, nose, and throat. ENT surgeons. So those are doctors that actually take care of the ear. So they are the ones that will check the ear, know what is going on with it. And for you, like you now, when they get discharge, recurrent discharge and pain, it can just be chronic otitis media or otitis wanting. So anything chronic take a longer time to heal or take a longer time to be treated. So you need an expert to manage that case. to manage that case. You'll be surprised that there are some drugs or some procedure that need to be done for that your ear so that everything will go. So I still want to say, look for an ENT surgeon. It's not any doctor, not be private hospital business with this. If possible, go to a teaching hospital or FMC and see an ENT surgeon. So it will give you the right treatment so that the ear stuff will go. But note, it may take a longer time to treat it. It may not be something where you go today, next tomorrow, you don't wear. No, it may take a longer time.
Final, doctor, please, I'm having abdominal pain every time. Do I have a problem?
Dr. Fred, answer now.
My brother, abdominal pain every time. Pain is not normal. Pain is, there's no way you should be having pain and you think that it's normal. So if you're having abdominal pain every time, then there is a problem. I will advise you again, see a doctor so that they can find what is causing, find out what's they cause your abdominal pain. Because pain, the way God creates your body, creates to make you they live with pain. So every time pain means a problem, something that they cause the pain. So they need to locate them and attend to them quick. It's almost time to shut down. Okay, if you take any question, how you see?
Let's just take this thing and thank God question, because Naim will tell me we send the question. She first send, we consider me she will send that question. Tina, thank God. Yeah.
Okay.
I think it's the last question. Yeah.
Okay. See the question here. I have treated infection on 7th of last month, but now I have discharge and itching. Okay.
I want to say, I don't know how you treated it. If you completed the treatment, that's one thing. If you not complete the treatment, you need to know, say, you never treat yourself very well. That's one. 2, you do good investigation to even know which organism cause the infection when you say you get. And if really you actually had an infection, because say some of us, anything we see na infection. Anywhere we go, an infection I get. So you need to do some investigation to be sure that yes, you actually have infection and the best treatment for that infection. 3, your hygiene level still determine whether your infection will go or not. If you don't treat yourself finish and you continue doing those things where you're not supposed to do, it will come back again. And so if your hygiene level is not good enough, there's every tendency that you will still have this infection that you are complaining about. And then it may not just be infection, it may just be because of how you clean yourself. And 3, there are some soap, some cream, some many things that we apply in our body that can actually react to the body and give you things like discharge. And you think you are having infection. You just need to stop all those many things that you have been using. And what will happen is that everything will clear up. And so what our advice is, go to the hospital, make sure they run a test for you to be sure what kind of infection you are having, so that the best treatment will be given to you. 2, make sure your hygiene level is very okay. Know how to wash. Don't use soap. Don't go and be looking for what you did not keep inside. But wash the outer part very well. And 3, if those things when you they wear before, you see the wear and now you not sterilize them very well, they can still give you infection. So you need to sterilize all the things that you've been wearing, all the things that you've been using before, so that infection can actually. And 4, if na a sexually transmitted infection, I beg your partner need to be treated. Dr. Fred, I will sit together.
Yes.
Okay, because if your partner is not treated and you go back to meet your partner again, you will still come down with infection, because you just be saying that your partner they distribute, they give you free of charge. And maybe now you feel give and now he don't they keep and they wait for you. Anytime you meet and he will give you back. So as you treat yourself, your partner also needs to treat his or herself. Thank you.
Thank you very much, Dr. Israel. We are done. We can't take any more questions. Our time is up for tonight. Hopefully, during the week, come back again. We can answer some questions. This program now just 1 hour, 8 p.m. to 9 p.m., and then we are done. We don't want burn anybody data. Sure, you understand. Even we too, we dey burn data online, so we dey work with time and we respect your time. Any final words, Dr. Israel? Dr. Israel, you got any final words? Any final comments?
Okay, final word. Yeah. My final word is I want to first of all apologize for those who could not answer their question. I saw one question that somebody gave birth at 33 weeks. If the baby will survive without incubation, it is either is yes or no. Yes, some baby will survive if the baby is strong enough. No, the baby will not survive if it's not strong enough. So it's yes or no. So it's a two-way thing. So if you get allergy, just know, say, until you run away from those your allergy, there's no cure for it. And they will give you some drug just to reduce those allergies, but there's no cure for it. So I want to thank everybody that made today possible. And for the lady that won our gift, thank you for playing the game. And want to say, now make us there, and we'll try to continue giving you guys the best of our knowledge. Also know, say, we don't know all, we don't know everything. And so sometimes if we not answer your question, and it's not because we don't want to answer it, it's because sometimes we may not be able to give you the right answer. And still remember, say, we know the treat for you, and we just only the advise you. So even when we advise you, it not mean say you not go hospital. After, it's just an advice. So go hospital so that you get the best treatment ever. So that you get the best treatment ever. Happy Easter in advance to everybody. And for our Muslim brother, happy Ramadan to you guys.
Thank you so much. Thank you, Dr. Israel. Thank you, everybody, as you join us today. And no get anything will add again. That say, don't forget, say this program every Sunday by 8 p.m. And we will encourage you now to keep coming. God bless you. Like I always talk, good life now waiting. Oh yeah, now more complete them. Good life now waiting.
Yes.
Good life, nonsense. Thank you, everybody. Dr. Israel, still on the line first, quickly. Yes, good life, nonsense.
Yeah,
Guys,
I know.
Take care, and bye-bye.